Good morning, ladies and gentlemen. We warmly welcome you to another episode of the weekly Sunday webinar series brought to you by the Society for Health Research and Innovation. Today's lecture topic is spirituality in medical care. The lecturer for today is Dr. Shehan Silva. He is a senior lecturer in medicine and deputy proctor, Faculty of Medical Sciences, University of Sri Jayawardenepura. He is an honorary consultant physician in Colombo South Teaching Hospital, Sri Lanka. He has numerous publications and has delivered many invited speeches nationally and internationally. And his special interests are in geriatrics and palliative care, non-communicable diseases, medical professionalism, and ethics. The topic for today is spirituality and in medical care. Over to you, Dr. Shehan.
Good morning, ladies and gentlemen. Today's talk is on spirituality in healthcare. I thank the Sri JMOA for inviting me to present this talk today. So let's start with the case presentation. We have a Mr. Sumanadasa who is 68 years of age. He's a Buddhist, a retired principal, a widower with two children who are married. He has progressive shortness of breath, fatigue, and weight loss over a period of 3 months. And it is found out that he has stage 4 or advanced non-small cell lung cancer with a pleural effusion. He has declined chemotherapy and has expressed his interest in comfort focused care. In other words, palliative care. So throughout this admission, Mr. Sumanadasa has shown that he is anxious and he is not so conversant with people. He is regretting about his past actions and he has a scare about bad karma. He is also concerned about his estrangement, his feud with his son. He has communicated to the staff saying that he wants to see a monk, a Buddhist priest, and also have expressed that he wants to make an offering for the hospital. These were noted in the nursing records but not ever considered by the medical team. There was no formal spiritual assessment. There was no referral made to a spiritual care provider, and his requests were unintentionally dismissed as cultural expressions rather than genuine interest or in distress. So throughout this course while in hospital, his physical symptoms were nicely managed by the medical team with morphine and also with oxygen. However, there is no psychosocial or spiritual support offered. So the son was only contacted 2 days just before his death. However, it led to a very tense, unresolved interaction. Unfortunately, Mr. Sumanadasa died while in hospital without performing any kind of last rites, without seeing a Buddhist monk, without achieving the closure, the final goodbye that he had hoped for. So after his death, the family had expressed certain concerns. They said that he was afraid of dying without cleansing his karma. They also mentioned that he had asked for a Buddhist monk several times, but it could not be done. And they also acknowledged that there was pain. It was not just pain, but it was spiritual suffering. The son, who had problems with the father, visibly distressed, said, "I was not ready. We never got to speak. He died with guilt. Now I carry that guilt." So this leads to a concept called spiritual distress. Spiritual neglect in care can magnify or intensify emotional as well as psychological distress, as well as an element called existential distress. We'll talk of existential distress later on, where it goes beyond just physical symptoms and it cannot be controlled. So for a Buddhist patient or a Buddhist person, we know that merit making, the rituals and family reconciliation may be considered the most important part for a peaceful death. So when such elements are not addressed and there is failure to address them, it can result in an unfinished business. It can result in ongoing family grief and also moral injury for those of us like who are providing care. This is spiritual distress. So why is there a hesitancy or a resistance to talk about spirituality and religion? Do we question about this? So we question ourselves, why do I have to waste time on this? I'm just a doctor, I'm just a nurse. That my role is to cure the patient and to heal the patient. But why do I have to talk about spirituality and religion? Why and what will I do with this information if I ask about spirituality? What is the purpose of this? So I am not from that faith. Patient is from a Buddhist, I am a Christian. Why should I ask things about his faith or Buddhism and help in his faith? Or it can be vice versa. What if I don't have an answer? That's another question that we may be having. We want to help the patient, but we don't want to do that. Why? Because we consider that we may not have an answer. Finally, there is also a concern whether we would open a Pandora box. Pandora box is something, a box, as you know. So spirituality is indeed an important domain in the concept of health defined by WHO. As we know, there are 8 dimensions of wellness. It includes physical, emotional, intellectual, social, occupational, financial, and environmental domains. Spirituality is also an important aspect to make it a holistic approach. It is the inclusion of non-material or spiritual health dimension that makes the concept to be regarded as a dynamic or holistic health state, physically, mentally, socially, and spiritually in behavior. Spirituality is a dynamic concept. The amount of spirituality that one person has today may be different to what it will be tomorrow or in about 1 year's time. It changes according to the experiences that we come across, the stressors and challenges that we come across. And it is indeed an important part, an intrinsic part of humanity. Spirituality is a way to look into or to seek the ultimate or the end meaning, the purpose of life, and transcendence. We'll talk about transcendence later. That is going beyond what you see, what you experience. It is the reality in life. It is an experience of relationship, of self, of family, among others, the community, professionals, and also the nature, what we encounter, what we experience, and what we interact with. And it is significant. The amount of spirituality that anybody would have is something significant and it is unique, and that has to be acknowledged. And also it is sacred because it is considered as an important or a very necessary aspect of life. So it's a part of privacy, it's part of your personality, so it is sacred. And usually it is expressed through things like beliefs, values, traditions, and by practices. So this is the whole aspect of spirituality. It's a dynamic and intrinsic aspect of humanity, which is a mechanism to seek the ultimate meaning or the purpose of life, in other words, the transcendence. And it is an experience of oneself with the others and with the environment that they live in. And it also needs to be considered as significant, unique, sacred, and with privacy. And spirituality is expressed through various beliefs, values, traditions, and preferences. So spirituality is the search for existential or ultimate meaning of life. We use this word very often. What is existentialism? Existentialism is seeking the ultimate truth, going beyond what you see, what your physical eye shows you, your faith, your beliefs, your inspirations, your aspirations, and your supernatural, what you look into, the power other than yourself and what is there in the world. So it is a part of connecting with each other, your neighbor, and also with the reality, may it be somebody like God or anything that is beyond what you see. It is a transcendence, it's realizing who you are and what your purpose is. It's about faith and hope, what you believe and what you think is necessary to the very existence of life, and it gives strength and peace. So these are the elements that are essential about spirituality for each person. Spirituality is one aspect, religion is another aspect. Religion is maybe a part of spirituality, but just because religion is always there, it doesn't mean that it is spirituality. So religion is a set of beliefs shared by a community which is visibly expressed. This is something usually acknowledged with the existence of a god or deity, traditions, or even our religious sacred texts. So it is more practice and more ritualistic rather than what you believe and what you hope and think about. So two different things. Spirituality is one, religion is another one. So spirituality is a question about what do I find meaning in? Where do I find meaning in? How do I feel connected with another person and how should I live? Whereas religion is how should I practice something? What should I eat? How should I dress? How should I talk? How should I interact? How should I live? And it's about right and wrong, and it's about what is true. Is my religion the true religion? Is the other religion a false religion? That's religion. Whereas spirituality is finding true meaning, the peace and connectedness. So people consider themselves spiritual more than religious. And it's the other way around as well. There are people who would say that they are religious but not spiritual. And just think about that. A person can be spiritual but not religious. They may understand the meaning of life, about what their purpose is, but they may not practice their religion in an external way. Whereas a person who is religious may not be spiritual. That person may demonstrate religious practices externally, but will have the worst sort of motives, behaviors outside the religious practices. So these two can lead into assumptions and misunderstanding. Spiritual care in any person, may it be a patient or not, is a continuum. It's with assessment, it's about counseling or helping a person to come to a solution rather than you instilling something. Having support, being there, the very presence of it, and also it may be a ritual. So there are four things: assessment, you probe in and find out what's really going on in their lives, you counsel or you facilitate a person to come to a solution in what they are doing and what they want to do in their life. Being there, being a supportive person, the very presence, and also manifesting it in a religious way in a ritual. So it's an umbrella which includes two things: the religious care, as in your rituals, and about this pastoral or the spiritual care to come to a meaning in life. So religious care is demonstrated at places of worship, churches, temples, mosques, any place. May be manifested in a Bodhi Puja, a Pirit ceremony, the sacrament for a Christian, prayer services, Shanti Karma, meditation, whatever it may be. Whereas pastoral care is something that happens in the hospital itself, the institutions, and also in life events, where there is a visitation, may it be a religious person, a clergy, or may it be a person who is connected with that religion or spirituality, who will visit that person and be there physically. So it's a visitation. It may be involving meditation and mindfulness, or it may have certain amounts of occupational therapy. Spiritual care recognizes and responds the human spirit or the human soul when they are faced with life-changing events. At birth, at a life-changing trauma, at a dying phase, a surgery, ill health or loss, or even in sadness which has resulted in depression or low mood. And it includes the need for understanding meaning, self-worth, developing your faith, and also about rituals as well. It begins by encouraging a human to be compassionate, to understand in whatever direction that is required. So spiritual needs should be assessed in terms of the past, present, and future. So you need to probe in and see what has happened in the events that have led to this situation. They need to come out with the story, and you need to listen to it to find out about guilt and shame, regrets, about reconciliation, and finding about unfinished business. You need to ask a person, and you need to be in that physical present to show love and to be loved, not to abandon, and to find meaning in the suffering. And also you need to probe in about the future, what they want to do in their life, how do they want to change their life, how do they want to rectify things, how do they want to improve the quality of life. So it's a part of intrapersonal, interpersonal, and transcendence. We'll talk of that now. Intrapersonal is probing into the person's inner soul, asking who do they think who they are, why they are there, and what do they think about the meaning of life, what is their mission in life, and why do they think that that mission is there. So it's a search for meaning and purpose. The second thing is interpersonal, your relationship with the other people, your family, your spouse, your family, your friends, the healthcare team, the environment that you live in, the workplace, maybe a place of recreation, and also the rest of the world. It's the connection with our surroundings to probe into what one's role is and what is affected by the actions and what that person is hoping to achieve. Transpersonal or transcendental is beyond yourself, beyond what you see. The existentialism that I mentioned about. What do they think is going to happen life after death? How do they think that they will experience things after death? Will they go to heaven? Will they be reborn elsewhere? How do they think they will be remembered when they die? What will their legacy be? What will people think about them in the future? And what kind of impact is there in the society and even in the family? So that is transpersonal. So we started with intrapersonal, interpersonal, and then transpersonal, as in going beyond what you see. Existential distress is a part of spiritual distress, where distress occurs in patients when they contemplate about their mortality. It's a feeling of helplessness, loneliness, anxiety, losing the meaning of life, maybe losing faith and meaning of life, and also the purpose. And it is an important source of suffering and influences people to even consider hastening death by taking their own lives. So that is something that we need to probe into our patients. Are they in existential distress just like they are in physical and psychological distress? We need to tap that area so that we can provide a proper medical care. Does spirituality matter to patients? Yes, as a study done by this Balboni in the States said that spirituality is shown to be important to most people with serious illness, even up to 3/4 to almost 100% of them. And spirituality needs are also common in that setting, even going up to 100%. And it is most often desired by patients who are faced with serious illnesses, including life-threatening illnesses and life-changing illnesses. Spirituality also can influence medical decision making in serious illnesses as well. So, spiritual matters are indeed important to patients. Spiritual needs of patients with serious illnesses, especially life-threatening ones, are frequently not addressed. We as doctors, we tend to take for granted such necessities. Spiritual care is infrequently addressed, and patients, most of them, even all of them, have been deprived of care or concern. Provision of spiritual care in the medical care of patients or clients with serious illnesses is also shown to have better outcome in end-of-life care. And unaddressed spiritual needs in patients are associated with poor patient quality of life. So what are the benefits of spiritual care? So when you address spiritual care in a timely manner, obviously there will be enhanced recovery and quick bouncing back to normalcy or support of resilience. People or your patients will have better coping mechanisms or develop better coping mechanisms of bereavement, guilt, pain, or even death. There will be a better understanding between the doctor and the patient or the client, building bridges, building therapeutic relationships, encouraging concordance and compliance. Concordance as in agreeing and the ability to continue the advice that one has given and practicing it in life. There's less likelihood of spiraling into serious illnesses or poor quality of life. And there will be certainly better physiological as well as psychological outcomes because there is bridging and building up of good emotional well-being. Well, the general well-being of the patient will be improved and there will be good satisfaction. This is recognized by many hospital accreditation uh, organizations and policy institutes, even with Joint Commission International as a part of holistic care. So, what are the duties of a healthcare professional? We need to respect each in others' needs and beliefs. We can't be intrusive and judgmental. We need to give space to each of our patients and allow them to live, to express, and to profess that spiritual need. Spiritual measures should be incorporated well, and also chaplaincy services should be encouraged. Chaplaincy doesn't include a chaplain only, as in a priest or somebody wearing the robes or any kind of religious attire, but anybody who is able to come and spend some time and be present and be able to be spiritually conducive to any patient by listening as well as by improving counseling mechanisms for completeness of life. You need to address all aspects of patient's life well. You need to educate patients with regards to mindfulness and cultivate good activities that are suitable and likable. The patient or the family won't announce or will bring both saying that they have spiritual distress. It is the responsibility of the clinician to discern or to find out what they have with the sixth sense. As Hippocrates says, the physician must be able to tell the antecedents, know the present, and foretell the future. The physician to be able to discern what has happened in the past, know what's happening in the present, and determine what would happen in the future. They must mediate these things and have two special objects in the view of regarding the concept of disease: to do good and not to do harm. So these are some of the themes, recurring themes that you may encounter when you speak to a patient and when you are assessing the spiritual health and needs of that moment. So these can be divided into 7 domains. The first domain is existential or meaning of life. When you speak to the patient, you may understand that there is a confusion in the patient with regards to the lack of meaning of life. The patient may question about meaning of one's own existence and suffering. They may say that I don't feel why I should be living. My life is meaningless. I feel that I am useless. Secondly, they may say that they are abandoned or lost. The theme that comes from the history is that they will say that they don't have love, they don't have anybody to care for, they are feeling lonely, no one will remember me, and there's no relatedness. Examples when they are speaking would include: no one understands how I am suffering. Where is God? Frequently we can encounter that question. There's also a theme of grief or loss, where it's related to loss of health, loss of a loved one, loss of the body image, loss of the societal role. So they may say that, well, I used to be active long time back. Now I am bound to a chair. I don't want to have my friends see me in this situation. Don't let them come. I'd rather die than them see how I am in this situation. So that is grief. The fourth element is guilt or shame, where they have a feeling that they have done something wrong in the past, committed a sin, committed a crime, committed some kind of damage to another person. Well, I used to be so active, now I am not. Now the pain is that I am going through is my punishment. I am being subjected to a huge amount of trials. I feel that I am going through a time of being tested. So that is guilt and shame. Reconciliation is also another theme that can come, where patients who are ailing will say that they need forgiveness or they want to forgive another person. I wish so and so could forgive me. I wish I had spoken to that person. So these are themes that may come. Religion specifically can give rise to certain themes. Patients may feel and say, well, I can't pray, I can't read the Bible, I don't feel like listening to Bana, I don't think I want to go to church, unable to participate in practices and rituals. Finally, they may also express that they are conflicted or challenged by belief systems. They may question themselves and say, what if I believe is all wrong? After my death, will I go to a place where I have never ever thought of? Well, will I be born in hell, or will I be born in heaven? Will I be incarnated as a worm? These are things that people will come across. These are subtle or even significant signals of spiritual distress which we would come across. So there are a couple of tools that are useful in screening spiritual needs. So one of it is this scale called HOPE, or the questionnaire called HOPE. Stands for sources of hope, organized religion, personal spirituality and practices, and effects of medical care and end-of-life issues. So we can ask our patients these questions and try to tap in those areas. So what are your sources of hope, strength, and comfort? So what do you rely on when you are going through a bad patch of time? Are you a religious person, or does religious practices help you? Do you have a personal spiritual belief? And what aspects of your spirituality or spiritual practices do you find most helpful? Does your current situation affect your ability to do things that help you to grow spiritually? Are there any specific practices or restrictions that person should know when providing medical care? So these are some elements of this HOPE questionnaire or tool that will help to screen these type of spiritual needs. Another tool that is used is this thing called FICA. FICA stands for faith, importance, community, and address in care. Faith, as in questioning about what kind of belief or faith do you have. Importance, what is the importance of that faith in your life? Are you a part of a spiritual or faith community? Do you address or how would you like to be addressed by your healthcare provider in such times? So these are subtle things you can probe in. So there is also a score called the spiritual well-being score, which are composed of religious well-being and existential well-being, very useful in our setup. And recently, which we have validated to Sinhala, myself and Dr. Ramadasa, Udayangani Ramadasa, spiritual needs assessment for patients. It's validated in Sinhala now, where there are 3 domains: the psychosocial domain, the spiritual domain, and the religious domain. So you need to, which after screening of identifying such problems, you need to get engaged with managing problems. So you need to check yourself. So what do I believe? Have you ever questioned yourself? What kind of beliefs do you have? Strive to know your own spirituality. So we who are treating our patients, who are caring for our patients, we need to take care of ourselves as well. So those of us who are in the profession facing daily stress, we need to be mindful of burnout, and we need to know that we as healers need healing too. Physician, heal thyself. That is in the aspects of reticence and resilience. Another problem that comes across our way is that our tendency to do something. When we come across a patient who is ailing spiritually, we may be inclined to do something from our faith, or to do something that the patient has not expressed that they want to be part of. So doing nothing is the greatest difficult job in anybody's life, because it will take the courage to not do something which may have a repercussion in any person. So we need to sometimes even resist the urge to fix and take care of our patients, just simply by giving the presence of yourself in communicating with the patient. Remember, medicine is a service. We have to help, fix, and serve patients. But when you help a person, you consider life as weak. When you fix something, you perceive that life is broken. When you serve, you see life as a whole. So, fixing and helping are work or works of the ego, whereas the service is the work of the soul. I mentioned about compassionate presence, being with somebody who's in distress, just being quiet. So there's a story about a toddler who built a castle out of building blocks, and that was destroyed by some birds, and the child comes across various animals, including a snake who tells the boy to go and have revenge, the hyena who says take it simple and laugh away, the ostrich who says to hide from the truth that has happened, the kangaroo who says to throw off everything that is in a mess, the elephant who says let's try to find a solution by thinking what we can do. But all of these animals were in vain. But it was only the rabbit who was helpful. The rabbit doesn't talk. The rabbit slowly comes to the boy and waits near the boy. That's the compassionate presence that is required. To be there when somebody needs, not necessarily to do something always. So you need to listen to your patients holistically in all of these aspects. the intellectual aspect, the emotional aspect, the physical aspect, and also with spiritual awareness. Remember that you need to resist the temptation of urging somebody or prescribing somebody your own beliefs or practices. That is called coercion or compulsion, unethical conversions, where you would say, oh, if you had been a part of my faith, you would have not had this problem. So change your faith. Medically, professionally, in clinical medicine, you should avoid such behavior by avoiding spiritual altitude, where you think that you are at the summit and you are looking down on the person who is low with an abhorrent attitude. So you do not proselytize a person to relinquish his or her own belief, but you'd rather professionally engage with that person. Ethically and morally, you need to consider the guidelines, medical ethics, including autonomy, beneficence, non-maleficence, and justice. But then again, what about the other aspects of ethics, such as truth-telling or veracity, getting consent, and being compassionate? So, medical service is indeed a service based upon integrity, doing good with a good heart and competence. So there are three words: sympathy, empathy, and compassion. So sympathy is just like what you do at a funeral. When you go to a funeral, you go and either greet or handshake with that person and say, with the loved ones of that person who has died, and say deepest sympathies. And then you come out of the place where the corpse is, and then you start talking with the other people, forgetting that you are at a funeral. You'll be talking of politics, you'll be talking of the weather, etc. So sympathy is like that. It's an unwanted, pity-based response which doesn't have the understanding and emotional touch. It's a moment only. Empathy is the affective response when you come across somebody who has had a similar illness that you have had. Then you feel that. That is empathy. You resonate. The word for empathy in Sinhala is sahakampana, as in your body, it vibrates with the other person's body in the same frequency. It's an affective response, and people tend to understand somebody else's suffering through resonance. But the best out of all is compassion, which goes beyond that. It's a virtuous response where you try to do something good by understanding in action. Compassion is going beyond that. In fact, the Greek word for compassion is equal to the word, comes from the bowels, the gut, or in Sinhala as we say, bokkeng. So you have to have that inner direction if you are acting in a compassionate way. So this is what I mentioned. Let's say somebody is having nausea and vomiting. You go by with sympathy and say, oh, I am sorry that you are nauseous. And then you write something to the person, and then you go to the next person. That is sympathy. But if you are empathetic, you will see, oh no, I know that you are having vomiting or nausea. I know it is a terrible thing. I feel it. That is empathy. So best out of that is compassion, which you will say, so let me help you by doing something for your nausea. Let's try to get this drug out. Let's try to change this environment that you are staying in. It's close to the toilet and it's dirty. That is compassion. So when you are dealing with somebody with spiritual needs, you need to have your conversations in the patient's requirement. The patient wants you to talk of a particular area of your life, let's say about the difficulties in a relationship, then you have to speak about it with the patient. But you shouldn't force your way through. Of course, you can tell the patient, look here, I am here for you. If you need me to address this, you can come back and talk to me. That is keeping the conversations in the patient's court. Keep your responses short. Don't give a lot of banner or sermons, but you rather give small chunks of information and be in presence. Then try not to digress and use that session as a form of gossip, where you will talk of this person, that person, and this is what has happened. You need to focus the patient rather than the disease and the cure. So think about how the patient is undergoing that problem and talk with heart to heart or head to head. So patients who are speaking from the head respond with head-based question. Let's say they are talking with their head from the mind, then you need to give something, the chicken soup for the mind. Storytelling, discussing the ideas in facts, paraphrasing and open-ended questions. If they are talking from the heart, you need to address from heart to heart or soul to soul. If they are expressing emotions and seeking meaning in life, that's how you need to address. Identify the physiological signs and act upon them. Person who is speaking from head may feel frustrated if the healthcare provider is emotional, and person who is sharing deep within may feel disappointed and helpless if the provider cannot or does not provide response with the questions instead. Finally, we come to another case, how it was differently handled. The first one, if you can remember, that person had a nasty experience. So this is a 72-year-old lady who is a Christian, widow, mother of 3, who is a retired nurse, comes with generalized fatigue, exertional dyspnea and poor appetite. She is detected of having congestive cardiac failure with frailty, and despite optimal analgesics, she is having uneasiness and insomnia, and she anxiously and repeatedly asks, is there any hope? So she questions, is there any hope? So she has lost hope. So that's a spiritual distress. So on deeper discussion, she is aware of what's happening, and she says that she is not afraid of dying, but dying unprepared. She's afraid of dying unprepared. She's concerned about it being a burden to her children and facing death without anointing or the last rites as in a Christian. She has expressed guilt over a family issue and that she may not be able to be there before passing away. And her faith, she says, with regards to her faith, she says that it's the most important thing that gives her peace at any particular place. So she underwent a hope assessment. Her sources of hope were the daily prayers, Bible reading, hymns, and finding divine grace. The organized religion was being an Anglican Christian, a staunch person, member of the church choir. The personal spiritual practices include prayer, personal devotion, attending church services, watching God TV or even Swarga TV. And the effects on care, what she required was, she wanted a priest to come, give the Holy Sacrament, say the sinner's prayer, have a benediction, reconciliation for her to go away. So the palliative care team coordinated with the vicar, the priest, or the hospital chaplain to facilitate the pastoral visit. She had her prayer of repentance, sinner's prayer. Certain passages in the Bible, like Psalm 23 and 91, were evoked, and she read them, and she was anointed. And there was space for the family to be there, and they had the Holy Sacrament. She was given Holy Communion before she passed away. They were encouraged to have the communication to relieve guilt and facilitate forgiveness. Psychological support was provided to address her fear of being a burden. So Mrs. Fernando was visibly more at peace after getting the sacrament. She died peacefully 2 days later, living with her family at the bedside. The daughter later shared, "Mum's biggest wish was to die with God's grace. The prayer being answered meant more than her getting any other medicines." So spirituality is integral to holistic care, and you need to differentiate spirituality from religiosity. Clinicians must be equipped to engage respectfully and in a meaningful manner. And small amounts of acts of presence and compassion will have profound effects. Thank you.